everyone, if you are a nurse, especially a psychiatric nurse, and you don't know what electroconvulsive therapy is all about, I think you need flogging. During my psychiatric posting as a nursing student, whenever I hear convulsion, what comes to my mind is neurological dance. The brain is causing that individual to dance, not music. So whenever I hear electroconvulsive therapy, it simply means that therapy that induces, that artificially induced neurological dance. Good day everyone, and welcome back to Nurses Lecture YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for students. Today we're going to be talking about electroconvulsive therapy. What is electroconvulsive therapy? What are the various types of electroconvulsive therapy? What is your nurse's responsibility before, during, and after electroconvulsive therapy? And also, what are the various complications associated with electroconvulsive therapy? I really don't want to miss out on any of this point. That is why I will be using my phone, and also I have documented a lot on the board. But before we go into details in today's class, please, if you are new on our YouTube channel, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be talking about electroconvulsive therapy. You can see the word electro and convulsive. You can remember I said at the beginning, whenever I hear convulsion, convulsive, what comes to my mind is neurological dance. Neurological dance, as the brain is making that individual to dance. But don't write that in your exam. Now the details proper. What is electroconvulsive therapy? Electroconvulsive therapy is a procedure done under general anesthesia in which small currents are passed through the brain, intentionally triggering a brief seizure. Electroconvulsive therapy, the main aim is to trigger a brief seizure. Let the person ginger, like you are depressed for too long, come and ginger, let me see. You understand? That is what electroconvulsive therapy is. Like ginger yourself, stop being stiff. You get? So it's what? It is a procedure that is done under general anesthesia. This person, they have to give this person anesthesia, so this person does not know what is really going on. So when it's been done under that anesthesia, electric currents are passed into the brain so that a brief seizure can actually take place. It is actually for therapeutic reasons. It is not for fun. That takes us to the types of electroconvulsive therapy. There are basically two types of electroconvulsive therapy. We have the bilateral and unilateral electroconvulsive therapy. You don't need a soothsayer to tell you what this is all about. Bi simply means two, right? Uni means one. So bilateral electroconvulsive therapy simply means passing currents through two sides, two sides of the brain. While uni simply means one side. So which one do you normally use in your facility? Kindly drop on the comment section. Remember, there are two types of electroconvulsive therapy. I'm hitting it again. We have the bilateral and the what? And the unilateral electroconvulsive therapy. As the name implies, bilateral two parts, unilateral one part, current is being passed through. Then that takes us to the indications for electroconvulsive therapy. Why would I give my patient electroconvulsive therapy? What is really happening? So that is indication. So the first one is major depression, like a depressed patient that refuses to leave that depressive stage. We have to give you the neurological dance artificially. And what do we use? We use electroconvulsive therapy. It's actually very effective for patients with major depression. Then the second indication is mania. What do we mean when we mean mania? Like mania simply means excitement. This person is always excited. You know, somebody is excited. So it can also be used for ECT can also be used for mania. It can be used for obsessive compulsive disorder. Come on, what is obsessive compulsive disorder? See, I've noticed that almost everybody in this world, 99% of the world, actually, it's not my research, it's not their research, it's who did the research? my subconscious self did the research and said that 99% of the world are having this obsessive compulsive disorder. Have you ever been in a situation where you're like, oh, did I lock the door? Are you sure I locked the door? And unfortunately you locked it, but to confirm it, you go back and check. Oh, I actually locked it. Oh, did I sweep the house? Where did I drop this? Did I drop this thing here? So you've done it, but your mind keeps telling you, oh, I've not done it. Obsessive, you are obsessed. There's this obsessive compulsion to do a particular thing, to check if you are perfect or something. So that's obsessive. There's obsession, there's compulsion disorder. Then we have catatonia, very stiff. This person is stiff, does not want to move. We have to give you neurological dance, which is electroconvulsive therapy. Then we have bipolar disorder, which is psychosis, as the name implies, psychosis. So bipolar disorder, this person is having an episode of mania, an episode of depression, like two sides. Today this person is happy, today this person is sad. That's why it's bipolar disorder. So you can also use that. Then failure of drug therapy, they have been using some antidepressants, they've been using some of all these drugs, but it's not working for the patient. So you can give electroconvulsive therapy. Then the last one I have here on the board is treatment of non-psychiatric condition. Yes, I was so surprised whenever I hear electroconvulsive therapy. I was thinking it's only psychiatric conditions that we actually use this ECT for. But later I found out that you can actually use ECT for Parkinsonism, Parkinson disease. And Parkinson disease is not a psychiatric condition. So it can be used to treat Parkinson disease. And for those that have had the history of, oh, they've used electroconvulsive therapy, it worked perfectly for them, so they can also use it. That can be an indication to actually help them out when it comes to psychiatric illnesses. Do we get now? Remember indications, we have major depression, we have mania, we have obsessive compulsive disorder, we have catatonia, we have bipolar disorder, we have failure of drug therapy, and we have treatment of non-psychiatric condition. Very easy. See, when you're in the exam hall and they ask you what an indication for electroconvulsive therapy, don't leave the book blank. It's our rule. What you have to think of, just think of any psychiatric illness and put there. It is well with your soul. Trust me. Then the next topic I'm going to be talking about is the nurse's responsibility. What are your nursing's responsibility before, during, and after electroconvulsive therapy? What are you to do? Remember the video, the group or the video is for nurses. So there's no way I'll treat electroconvulsive therapy without telling you your nursing's responsibility. So the first nurse's responsibility I have here is explain procedure to patient. See, anything at all you want to do to a patient, the first thing is to explain procedure to the patient. Tell the patient what you are about doing. Whether the patient is sick or the patient is normal, the patient is not normal, explain procedure to the patient. Let the patient be aware of the procedure you are about carrying out in him or her, on him or her. You get? And also obtain an informed consent from the patient or the carer. It's possible this patient is not mentally okay, does not have the mental capacity to actually understand what the procedure is all about. But it's advisable their relative, their carer, the person that is caring for this patient, you seek consent from them, you allow them sign the informed consent before a procedure is carried out on the patient. See, whatever the procedure is, this is a giveaway point during the examination condition. The first thing before that procedure is to explain procedure. Explain, tell the patient, teach, educate the patient on that procedure. Then the second is to seek informed consent. They have to sign. You don't just go and carry out a particular procedure on a patient without signing, especially surgical cases. So you have to seek informed consent. You have to take consent from the patient. Then also discontinue all anticonvulsive drugs. If the patient is on anticonvulsive drugs, you have to discontinue that convulsive drugs before the electroconvulsive therapy. Then another I have here is assess vital signs. Remember, vital signs, they serve as baseline data. So vital sign is what you as a nurse, you don't need a soothsayer, you don't need a doctor, you don't need a nurse, you don't need a sign, you don't need anybody to tell you to carry out your vital signs, to check your patient's vital signs. You have to check your vital signs before or after any procedure. Then the other we have here is educate patients concerning procedure. You have to tell the patient, oh, this is what we are going to be doing. I'm going to be educating you. This is what you will do. This, let them know the procedure. I think that explains this. Then assemble resuscitative equipment. You don't know what's going to happen at the end, so it's advisable you assemble your resuscitative equipment. Your oxygen should be on standby, and all those necessary kits that are needed to resuscitate a patient back to normal in case there's an emergency should be on the standby. Then also remove tight clothing around the neck. You can't be giving electroconvulsive therapy when a patient is putting on turtleneck. Abba now, what kind of nurse are you? So you have to what? You have to remove all tight clothing. Ensure that this place is free. Ensure that this place is free. If possible, tie the patient a big wrapper. It's better off. Alright, that's that. Then also maintain nil per aura for minimum of 4 hours. This patient should not eat. Seriously. It is better for the patient not to eat before a procedure to avoid aspirations, of gastric content. During my clinical posting, electroconvulsive therapy is usually carried out in the morning. You get, by that time the patient has not eaten, the stomach is empty, because during the process there might be aspirations, and that is going to lead to further complication. Minimum of 4 hours before that procedure, the patient should be on what? Nil per aura. That is no food. No what? No food. Then also encourage patient to pass out urine. See, generally any procedure, be it oxygen or any procedure at all, it is advisable you tell your patient to pass out urine. If they are having this urge to pass out fecal matter, take them to the toilet, let them clear their body, so that it won't be a situation that they are having the procedure and all of a sudden you start saying urine and fecal matter. So take notes. Don't say I did not tell you. Then also remove and keep any dentures, any glasses, the patient's glasses, artificial eyes, artificial mouth, anything artificial. Try as much as possible to remove before the major procedure. Remove all those things. All patients' things, or their, what should I say now? All patients' property should be kept properly. I don't want to hear my glasses are missing or my teeth is missing. Then the other, maintain standard practice regarding general anesthesia. Maintain standard practice regarding general anesthesia, because this patient is going to be placed on what? General anesthesia. So I think a video will be done on the general practice when it comes to general anesthesia. Then finally you can put the patient on a trolley and take the patient to the ECT room for electroconvulsive therapy. Then the next heading we are going to be talking about is nurses' responsibility during electroconvulsive therapy. Like I earlier said, we're going to be discussing the nurses' responsibility during the electroconvulsive therapy proper. So what is it? I'll be using my phone because my body is small and could not accommodate much, and I don't want to miss a point. So the first nurse's responsibility during electroconvulsive therapy: make patient comfortable in a dorsal supine position and maintain patent airway. Looking at the screen, that is a picture of a dorsal or supine position. So you place patients in that position during electroconvulsive therapy and ensure that the airway is clear. Though we all know that the airway, this airway you see, anything obstructs the airway, life is 50-50. So you place the patient in a supine or dorsal position and ensure that the airway is what? It is patent. Then the other one I have is support patient's jaw with rubber mouth gag. You can see the picture on the video now showing you have to support the patient's jaw with a rubber mouth gag during the procedure. Then the other is apply lubricants to the electrodes. These electrodes are to be applied on the sides of the brain, on the side of the head. So when you apply it, you have to apply lubricants, you understand, to prevent those unnecessary friction. Then the other is support shoulder arm and restrain the thigh with bed sheet. You have to support the shoulder arm and restrain the thigh with bed sheet. Then make observations of the convulsion. You have to make observation of the convulsion, the duration, and how long does the duration, when it started, when it ended. You have to take note of that. Then the other, suction patients when necessary. That's what you're observing. So when there is secretions in the mouth or that's obstructing the airway, you have to suction immediately. Then restore respiration by oxygen administration if necessary. That's why, remember before we said that you should put all your resuscitative things on ground in case there's an emergency. So you give oxygen when necessary, then record seizure activity. Remember, in nursing, what is not documented is not done. You can't say, oh, during the process I can remember this is what happened. Document it. You have to record seizure activities. Then finally at the end of the procedure, you clean up the patient and reassure the patient. Hope you are writing down. If you are not writing down, move that cursor back and start again, then get all the necessary points for your exam. Then the other heading is nurse's responsibility after electroconvulsive therapy. We've done the before, we've done the during. Now it is time to discuss the nurse's responsibility after electroconvulsive therapy. The first one I have here is for you to move the patient to the recovery room. You don't leave the patient inside the ECT room now. No, now. You have to take the patient to the recovery room. When you get there, you have to observe the vital signs every 15 to 30 minutes. Then also position the patient on a side line and clean secretions. You know what side lining now? It could be at the right side or at the left side. You have to position the patient side lining. Then the other point I have is administer oxygen when necessary. When this patient is out of the ECT room, the best thing is to what? Is to administer oxygen when necessary. Then also remain with the patient until fully recovered. For psychiatric nurses that leave the patient on the bedside during the recovery phase, that is bad. So what you have to do is to remain with that patient. That is why you are there. You have to remain with the patient during the period of recovery. Then another point I have here is reassure and reorient patients to the ward. The patient is back. You don't know if the patient is still having score. What you have to do is to what? Oh, welcome back. This is the ward. Let the patient know what's going on in the ward. Let the patient know that you are in the ward and you people are back from the journey of electroconvulsive therapy. Then another point I have here is allow patient to have sips of any drink. Remember, this patient was on nil per aura before electroconvulsive therapy. What you have to do after recovery, you have to allow them have sip. They can tell you, oh, I want to drink Coca-Cola, I want to drink Fanta, I want to drink Sprite. So give them their brand. I'm not saying give them alcohol. You get. Then also record the procedure. Everything you have done has to be documented, because what is not documented is not done. Then the other, clean all used equipment and replaced. You have to what? You have to clean all used equipment and replace. It is of paramount importance. So that is the nurse's responsibilities before, during and after electroconvulsive therapy. That takes us to the complications our patients get when they are having electroconvulsive therapy. Let's talk about the complications. One of the major complications that you have to take note of is headache. Ah, Jesus. You've not seen a patient, like I experienced that, and I was like, oh my God, what's wrong with this patient? After electroconvulsive therapy, she came back like, oh, my head ached badly. Like there's severe headache, there's brain damage. We don't pray to encounter that, but that is one of the complications. That is why it is a complication of electroconvulsive therapy. Then there's hypotension. What is hypotension? Hypotension is reduced blood pressure. There's memory loss. That is why you have to reorient the patient to the ward when you come back. Don't know, is my patient having memory loss? Then there's aspirational pneumonia. That is why it is advisable the patient should be on nil per aura, because these patients might go down with what? Aspirational pneumonia. There could be confusion. There could be fracture of lung bones. You remember, this thing is neurological dance. This person is dancing. So during that process of doing the neurological dance, there could be fracture of the lung bones. There could be dislocation of the temporomandibular joint, temporomandibular joint. There could be cardiorespiratory arrest. There could be prolonged seizure. Instead of brief, there will not be prolonged seizure. There could be status epilepticus. and if care is not taken, complication is death. During my exam period, when I don't know what to write when it comes to complication, after writing one or two, the last one I normally drop is death, because even malaria can lead to death if not treated. I hope this video actually help you understand what electroconvulsive therapy is all about. Thank you very much for watching our video. Thank you very much for staying tuned. Please don't forget to click on the like button. Don't forget to subscribe. Don't forget to share with a friend if you got value. Come on, for those that have not registered for our classes on Telegram, you have been missing a lot. Like seriously, we have a lot in stock. We have a lot of voice notes. They are being arranged according to systems: cardiovascular system, respiratory system, dialysis, research, community health. There are voice notes prepared for you to make learning easy and accessible. For those that have not registered, all you have to do is to send a message to the WhatsApp number showing on your screen. See you in our next video. Bye.